So we're going to get right into it. And our first speaker is Anthony Henry. Anthony is the current president of the Walnut Foundation. He has served as an advisor to the board and now is the current president. Anthony's history of prostate cancer will be addressed by him. It's a very interesting history.
Time. Of course, I did not know any better, so couldn't challenge him. The outcome for us, sadly, is that father died at 68 from prostate cancer. In terms of the lessons and the outcomes, for us, we developed a low trust factor for medical professionals due to my dad's experience. For you, I'm saying know your PSA numbers, help educate others, even if they're your medical advisors. We Afro patients are not all non-compliant, as the narrative goes, because I knew my dad. He was from the generation that respected authority figures. And if he was told to spend $15 for a blood test, that was not covered by provincial health insurance, he would have paid the $15 and had the blood test. My brother and I embarked on regular PSA screenings after this experience. I began screening at 40. My brother subsequently developed prostate cancer at age 57, and he was treated. I was diagnosed with prostate cancer at 54. And then an uncle, who's my father's younger brother, was diagnosed and treated during this period as well. For us, I would say screening does improve outcomes, because if my brother and I did not learn from my dad's experience, we would not have known that there was a problem. There were no obvious signs of anything being wrong with our health. I also want to touch on the issue of secrecy. We need to share our experiences. When families do not share health experiences, bad things happen. When you do not know your family history, you shortchange. We shortchange each other. My uncle, my brother, and I are beneficiaries of my dad's ill fate. We need to be our brother's keepers, and it is a part of why this conference is important today. It is so vital, in particular for Black communities, where incidences of prostate cancer are 76% more likely, and where we are 2.2 times more likely to die from this disease. In terms of my diagnosis, as I indicated previously, I started PSA testing at 40. And why do I do that? Why did I do that? I wanted to get a baseline PSA reading and monitor from there. My baseline PSA reading started at 0.79 and gradually increased over the years, sometimes declining. Overall increases were not dramatic, except for a mini scare in 2008. But that was later determined to be due to the fact that I had a digital exam at my doctor's office and then went upstairs immediately to the lab to do the blood test. That is a no-no. In this instance, my PSA reading had gone from 1.19 to 2.6, a change of 1.24 from the previous year. A retest a few weeks later showed a decline to 1.54. Okay, fast forward to 2014 November. At an annual checkup, my PSA had jumped to 4.41 from 2.61. Based on this, I was referred to a urologist. At the meeting, it was decided that because of my family history and the fact that I'd seen this significant jump in my PSA, that I would get a biopsy. The biopsy was done, and it indicated that 2 of the 12 samples that they took were positive with a Gleason score of 6. My immediate inclination was to go for surgery based on family history, based on the whole experience with my dad, plus the experience of almost everyone I knew up to that point. Everyone had elected surgery. However, given my Gleason score and a clean digital exam, my medical advisors at the time recommended that I go on a protocol called active surveillance. And I was referred to, there was a research project at the time that was going on at one of the teaching hospitals here in Toronto, Sunnybrook. So I participated in that. My cancer was still deemed to be non-aggressive. I had the benefit of drawing on the experience of the men in the Walnut Foundation, a men's health support group, and the sponsor of today's event. I had joined a few years earlier due to my family history. Most had opted for proactive treatments and had done either surgery, brachytherapy, radiation, or some combination of those therapies. The group was also bringing in speakers in the field, and was also connecting us with groups like Prostate Cancer Support Toronto, where men were sharing their experiences, or connecting us with support organizations like Expert Angle. This was a program that was run by Prostate Cancer Canada at the time. Prostate Cancer had since merged and has become a part of the Canadian Cancer Society. In fact, Movember was a sponsor for that program. So Movember has been a constant. Needless to say, there was a lot of discomfort and consternation to the idea of me going on active surveillance. There was a lot of raised eyebrows about this recommendation. In fact, there was a blur of opinions, some helpful and some just plain rude. You don't need your prostate. Get rid of it. You're not your dad. His cancer was his cancer. Your cancer is yours. You're making a mistake. Active surveillance is not for Black men, or a variety of cancer is too aggressive. Don't let them study you with invocations of Tuskegee and how in that experiment, treatment was withheld away from Black men to see what the natural outcome would be for untreated syphilis. Nevertheless, my decision was to defer treatment and participate in the 2-year study. And my rationale here was, if the cancer was not growing, then there was no urgency to move the treatment. Besides, my participation will help me to answer the question of whether or not active surveillance was a suitable standard of care for Black men. That was just me in the back of my mind. That's how I was thinking. Yeah. Is it for us? Is it not for us? And this study was looking at MRI, the whole usage of MRIs, and to see if it could be a substitute for doing the painful biopsies, and investigating how MRI might better be utilized in assisting with low-grade prostate cancer management. It involved more frequent PSA and digital exams, biopsies when necessary, MRI-guided biopsies as a part of regular updates. That program ran for 2 years. And for me, one of the good things was I was being followed closely, and I had access to specialists. That's very important. I remained on active surveillance for 9.5 years. So in effect, no treatment for my cancer, just exercise, more attention to my diet, and a focus on stress reduction at work. Active surveillance worked for me to the extent that my cancer remained a Gleason 6, that my PSA remained stable, and my prostate size remained manageable. Anxiety cannot be overlooked for this path, right? Because you're constantly being tested. PSA rising, PSA falling, routine biopsies and MRIs, and having to answer questions about your health. My PSA continued to climb in fits and starts over the years until it finally capped out at 13 in 2023. My prostate gland had grown in size from 50 cc's shortly after diagnosis in 2015 to 96 earlier this year. This meant I had all the signs of BPH. BPH, for those who don't know, is benign prostatic hyperplasia, which impacts a lot of us men as we get older. And that walnut-sized gland gets bigger. I also developed unrelated complications with my red blood cells, which is currently managed with medication. After 9.5 years on a strict active surveillance protocol, I felt like I was lucky to be still alive and healthy. But the toll of constant testing, an uncontrollable PSA, long wait times to see specialists, an ever-growing prostate, and the unknown with my unrelated red blood platelets. I felt like it was time to move on to active treatment. In June 2024, I underwent laparoscopic prostatectomy to remove my prostate. For the gentleman, what I would say is, you know, um, you know, make use of their knowledge. You don't know anything about incontinence products, for example. But if you're quiet, you don't say anything, then you suffer through all kinds of embarrassments. Make use of the knowledge of the men who have gone through similar treatment protocols to yours. Who better to talk to than someone who has had a cystoscopy, a biopsy, or if you had to deal with the indignity of my sexual rehabilitation. I have also signed up for the PC PEP program that's run out of Nova Scotia. This one will provide daily tools on how to manage my challenges. So these resources are out there, so I urge you to take advantage of them. We'll post the links to those some of those resources in the chat later today. Luckily, I have a great wife who is my partner in life, supportive kids, and an extended family. About giving back. And so it's a great resource that I've been able to lean on to guide me along my journey. I should also shout out my initial medical assessment team who felt comfortable referring me away to the teaching hospitals in Toronto, Sunnybrook and Princess Margaret hospitals for second opinions or to review my case. I also recognize that my experience is not necessarily the norm because many of the men we deal with at the Walnut Foundation have not had favorable experiences vis-a-vis, in terms of patient care, how they interact with caregivers, and timely follow-ups. A few takeaways from, what I'm saying here today is you need to advocate for your health. Second opinions are important. Don't underestimate that. Patients should feel empowered to ask questions and seek second opinions about their health. Family history matters. Understanding your family's medical history can be crucial in identifying risk factors and making informed decisions. Remember, the symptoms do not always present themselves in a clear, concise, and easy to understand manner. Communication is key. Sharing health experiences within families can lead to greater awareness and preventative measures. Encouraging open dialogue about health can help break down stigma and secrecy. Don't put your partner in an awkward position by not disclosing vital information about your health and then expect support at the 11th hour. Support networks, family support, support groups have been invaluable in my understanding of my prostate cancer and navigating the whole process. Engaging with others who have similar experiences can provide both emotional support and practical advice. In terms of active surveillance, as I'd say my journey into active surveillance shows that treatment decisions should be individualized based on personal health factors and should consider options that may improve quality of life without unnecessary interventions. Yes, Black men can go on active surveillance. I'm living proof of that. Mental health. Acknowledging and addressing the anxiety that can accompany active surveillance is essential. Supportive partners, families, and community resources can alleviate stress. This has been my journey and may not necessarily be yours. But I hope that by sharing my experience, I may help you to better navigate your personal prostate cancer journey. The hope also is that sharing my journey can help others understand the complexities of prostate cancer and the importance of continuous learning, support, and advocacy in healthcare. If you have any specific questions or need to ask any questions, I'm available. I'm not sure if we're going to take questions now or.
Do we have any questions from anyone here? Are there any online questions?
So it's no questions. So it sounds like I did an excellent job then. Awesome. Okay. Thank you.